Hi, this is Frank with a frank opinion. Is your congressman dangerous to your health? Mine is. It's dangerous to me, my family's health, and I can't help but think that he's dangerous to your health. His name is Tom Suozzi, Democratic congressman representing New York's 3rd Congressional District. In the over 3.5 years that he's been in office, I've had occasion to, as a good citizen, try to provide information, research, data, connections that would provide him with an abundance of information, actually, on the absolute benefit, not only in terms of providing health care universally to everybody in the United States, womb to the tomb, but lowering health care costs dramatically and improving cash flow to American citizens. Over 95% of American citizens will improve cash flow as a result of the current structure of the Medicare for All bills. I've met with his state director. At that meeting, I brought with me, and thank you very much, 2 representatives from the Physicians for a National Health Program. At that meeting, I bought him a book, An American Sickness, by Elizabeth Rosenthal, How Healthcare Became Big Business and How You Can Take It Back, hoping that he would read it. Subsequent to that meeting, at which we gave him a tremendous amount of information, data, and stories, Cindy Rogers, his state director, had some questions that she was representing in terms of the questions that he might have. I wrote back, answering those questions. In that letter, I indicated that there had been already 7 national studies, Governmental Accounting Office, the Congressional Budget Office, the Economic Policy Institute, and no less than 12, and I think it's more now, state research studies that indicated that single payer was the best way to go for our country. In that letter, I indicated that I could put him in touch with a Dr. Gerald Friedman, economics professor at Amherst University of Massachusetts, who has done an amazing amount of work since the year 2013 on the old H.R. 767 bill and currently on the H.R. 1384 by Pramila Bayabel, and that Dr. Friedman would be willing to at least speak with Mr. Suozzi, if not, possibly come and meet with him. No follow-up whatsoever. I've been to town halls, 5 of them. At one of them, I gave Tom this packet, Fix It, from the fixithealthcare.com, an initiative, a fantastic initiative, produced by a medium-sized business owner by the name of Richard Master, who years ago, realizing that the only cost that he could not contain in order to try to develop a profit and still have adequate, robust health care insurance for his personnel, was the health care premiums that were going up each and every year by health insurance companies, private health insurance companies. So he developed an initiative that also has a business component, business involved in health policy, produced videos on DVDs and that you can see online, ways of getting involved, supported local efforts, grassroots efforts in Pennsylvania. Fantastic man, Richard Master. I gave Tom this book, this packet, loaded with information, hoping that he might watch one or more of the videos. Tom is a member of the Ways and Means Committee. And the Ways and Means Committee is one of 2 committees that has original jurisdiction over H.R. 1384, the Medicare for All Act of 2019. In those 5 minutes that were allotted to each and every congressman on the committee, he chose to do what he has been doing for the last 3.5 years, pretty much. The first minute, he talked about and mentioned the woman and her child that were there that were there before the committee to provide testimony related to their horror story, their tragic story, dealing with private health insurance. He then used a minute or more of his time to complain, saying that his constituents, Americans, are sick and tired of the bickering back and forth, Congress being at a standstill, the failure of coming forward with bipartisan solutions. He is vice chair of the Problem Solvers Caucus, and he does that at every town hall meeting. He kind of filibusters his own town hall, so I think there can be a limit to the number of questions that are asked. It used to be that people would come up at a podium to ask him, but now he calls on people. Another significant strategic move. He then used his remaining time to ask questions of the panel. He, as he's done in previous town halls, feigned ignorance about this subject matter and used one of the first people that were there as experts to say, by the way, these numbers kind of run in my head, and you would be a good person to kind of ask about this to set me straight. There are about 170 million on employer-sponsored health care. There are 100 or 120 million on Medicare and Medicaid. There are another 30 million that are uninsured. He's answering his own question after the expert said whatever little she did, because he already knew the answers to these. He's been reciting these probably in his sleep for the last 3.5 years. And then he says, well, there's 15 million on the individual marketplace, and that's where we hear the horror stories. Well, that's not where we hear the horror stories only, Congressman Suozzi. We hear them from every sector of those that are covered by insurance. In fact, the first expert said, well, a lot of people are happy with their insurance. It's when they get sick. That's the issue. He didn't follow up with that. He neglected the 30 million uninsured, mysteriously. And he focused on the 15 million in the private market, saying that maybe if we juice up the subsidies, etc., which really go and guarantee profits for private health insurance companies, etc., that maybe we could work towards not ending but mending the ACA. What blew me away was when he is prefaced to Dr. Don Berwick. Dr. Don Berwick is a former administrator of the Medicare and Medicaid Center Services. He has written no less than 8 books on healthcare, dating all the way back to 1980. In 1980, he wrote Cholesterol, Children and Heart Disease, an Analysis of Alternatives. In the next to last book, he wrote the book titled Promising Care, How We Can Rescue Healthcare by Improving It. This is an individual who has dedicated his life as a public servant and as an author to improving healthcare for all Americans. His preface to his question to Don Berwick was, Don Berwick, I know that you're a Medicare for All pusher. Let me repeat that. I know that you're a Medicare for All pusher. My goodness. Tom is also aware, because we know each other, of my own personal, my family's battle with a subsidiary of United Healthcare for 1.5 years, going through hoops and every challenge that they put forward so that they wouldn't have to pay for medically necessary expenses. This is over 1,000 pages. There is no redundancy here. These are individual pages. It's not stacked like this to make it more than what it is. It was 1,000+ pages. For the final appeal, where we had the help of a young lawyer, and God bless him, we won that appeal. I'm a former deputy commissioner. I've read regulations, I've read laws, it's a complexity. I needed help to do this final appeal. Imagine a truck driver. Imagine a farmer. Imagine a salesperson. Imagine a low-wage worker working for McDonald's. Where are they going to muster the time and energy to do this? They expected me, and I've been told by others, to either die or give up. I did neither. We won the case. So I do not know who my congressman, part of whose job is to talk to constituents, saying that the only horror stories that we're hearing about is in the individual market. My goodness. 2020 Democratic primaries, if you have a progressive Democrat challenging an incumbent who's not progressive enough, you've got to support in every which way you can the progressive over the incumbent. If the progressive Democrat wins that primary and goes on to the general election, wonderful. Best of all possible outcomes. If the incumbent wins, Democratic incumbent, and he beats the progressive and stays as the district's incumbent, yes, you have to support that congressman or senator on November 3rd, 2020. You cannot vote for a Republican. That party has been trying to undo health care, Social Security, Medicare, everything. There's not a thing that they're doing for the American people. You've got to go with the progressive if you have a chance. Stay with the incumbent if that progressive loses. That's the game plan. I hope you follow it. Thanks.